A very good evening to you and a warm welcome to iMed. And today on iMed we will be focusing on diabetes, but we have generally spoken about diabetes. But today we will be touching on one type of diabetes, which is gestational diabetes. Why we selected this is because this year's theme is Access to Diabetes Care, and this is in line with the World Diabetes Week, and we selected this topic because during the pandemic period there was a little access for diabetes centers or diabetes care for pregnant mothers. So that is the whole reason why we picked this topic, because it's very timely. And to do the honors, we have Dr. Samanthi Kure, who is a consultant endocrinologist of the District General Hospital, Gampaha, and we're honored to have you here with us, Doctor.
Hi.
A very good evening to you. And as I mentioned towards the beginning, we will be touching on gestational diabetes. So in a layman's point of view, if you may tell us, what is gestational diabetes?
Okay, so gestational diabetes is a type of diabetes which develops during pregnancy. It's unique to the pregnancy, and usually the mothers get better after they deliver the child. So that is because of the placental hormones and the changes in the mother develops a transient diabetes during that pregnancy. But when we say diabetes during pregnancy, we might see mothers with pre-existing diabetes going for a pregnancy as well, and that is quite commonly seen in Sri Lanka.
So they are the mothers who have not got themselves tested, but they have it in their system, is it?
Yes, and there are others who already know that they have diabetes and then they go for a pregnancy. So there are various stages of diabetes which they have to go through the pregnancy.
How common is this, doctor? Do we see almost all the pregnant mothers going through this, or is it just for certain mothers only?
Well, it's very common in Sri Lanka because the South Asian people have a higher tendency of diabetes, and in Sri Lanka I think the prevalence is about nearly 7 to 10% of the pregnancies, and we see a lot of young mothers, lot of young girls with diabetes these days because of the obesity and the lack of exercise. So we do see a lot of women going through pregnancy with diabetes.
So take us through the worldwide statistics for gestational diabetes as well, doctor.
Okay, worldwide from various country to country there have been studies, although we don't have the proper statistics for Sri Lanka. If we look at the slide, it's about 5.8 to 9.2%. I think in our region we are on the higher side, especially India and Sri Lanka have a higher rate of diabetes in pregnancy.
And why do you think this is happening? Is it the diet or is it just workout?
The main reason is South Asians have a genetic predisposition. We are at a higher risk of developing type 2 diabetes, which is the form that where we have insulin, but the body generates a resistance to insulin. That is the type 2. So in our region we have a lot of type 2 patients, and we see that occurring at an earlier age because now the exercise and the lifestyle is the changes that happen during the growing up period. Because of that, young girls and young adults tend to develop diabetes earlier.
And type 2 diabetes, as you mentioned, has a lot of complications, isn't it? When you get a type 2 diabetes, if you're detected with type 2 diabetes, in the long run, if not maintained,
yes,
you get various complications, right?
Yes. Any form of diabetes, if it's not controlled properly, will lead to developing complications. So we could there are various forms where the big vessels get affected and the small vessels get affected. So if we talk about the big vessels, diabetes could affect the vessels of the heart, the vessels of your brain, the kidney vessels, the vessels supplying your limbs, and then it could affect your eyes. And diabetes is a leading cause of blindness in this world, and it's the leading cause of kidney disease as well. So usually the complications develop about 10 years after the diagnosis of diabetes, but it would develop sooner if you don't control it properly. And the better you control, the more you can delay and the less occurrence of complications that you would see.
And doctor, how important is it for you to check your diabetes or see if you're prone for diabetes before you plan your pregnancy?
It's very important because diabetes during pregnancy has so many implications, not just for the baby, for the mother as well. So it's very important that you check yourself for diabetes as soon as you plan to have a child, as soon as you get married. And if you're planning to have a baby, I think you have to consult your doctor or visit the nearby clinic and get yourself checked for diabetes. Because if this is undetected, especially in the first 12 months of pregnancy, it can lead to a lot of congenital malformations, and even if the malformations are drastic, it can even lead to abortions. So many of the congenital heart disease, like you must have heard the hole in the heart, and all these malformations of the heart and other malformations occur due to uncontrolled diabetes, especially in the first 12 weeks of pregnancy.
And doctor, also take us through this. We spoke of type 1 diabetes, type 2 diabetes, and now this is gestational diabetes. That's the whole topic. That's what's this program about. So tell us the difference between type 1, type 2, gestational. Now, you mentioned that gestational diabetes goes away after the delivery, isn't it?
Yes. So type 1 diabetes usually occurs in children, but we do see in adults as well. It occurs due to absolute lack of insulin. So the pancreas stops producing insulin. So for type 1 patients, you have to treat them with insulin, and they are also called insulin dependent. They cannot be treated by oral drugs. And most of the time we see it in the young children and young adults, and it's very disabling because they have to inject insulin many times a day, and if they are not supported properly, and if the families are not supported properly, there are a lot of issues for not just the child, for the whole family as well.
And we are on the topic of gestational diabetes. So let's talk about the effects on the body and how early can this be detected. Now, if someone's pregnant, how soon should they go and get themselves tested for diabetes?
Okay, so as soon as you know that you're pregnant, you would either go and visit a doctor or an obstetrician, or you would visit the clinic, the government clinic. So as the first visit is called the booking visit, and in Sri Lanka we screen all mothers at the booking visit for diabetes, and ideally this should be done by giving them a glucose challenge test, because by just doing a fasting test we might miss diabetes, and if it is missed, it's a huge problem for the patient.
Is it the case even for a normal person? Just a fasting blood sugar might not detect diabetes, or is it just for pregnant mothers?
Even for a normal person, sometimes fasting blood glucose might miss. So ideally, if the person is not having symptoms, we have to confirm by doing two tests: the fasting blood glucose plus or minus HbA1c, or a postprandial blood glucose. So two of them have to be positive if the patient is asymptomatic, for us to make a diagnosis of diabetes mellitus.
And this will be done when they go for the first booking, when they get pregnant, the pregnant mothers.
Yes. So at the booking visit, all mothers, irrespective of their age, where they come from, universally all mothers in Sri Lanka are tested for diabetes at the booking visit.
So let's talk about the effects on the mother, on the body of the mother when she's detected with diabetes.
So diabetes, more than the mother, the effects are on the baby, because the mother's blood circulates through the fetus, and it's with that high blood glucose levels the fetus develops. So actually high glucose is teratogenic for the child. That means it causes the child to get malformations. And later on, once the organs have formed, if the blood glucose level in the mother is not controlled, the child would become very big, and that would cause obstructed labor and so many problems during the delivery. And there are other complications as well. Sometimes with diabetes, the babies would become small for age. They would be delivered preterm. There is a higher tendency for infections, and there is a higher tendency for the mother to develop high blood pressure. So overall, the rate of complications is very much higher, and if the mother has diabetes, we would usually advise them to deliver earlier. We would not wait till their full term. Usually at around 37 to 38 weeks of gestation, we would ask them to deliver the child.
And this sounds very scary when you say that, when the sugar level is not controlled, there could be a lot of complications with the baby, and also might be prone to more infections, and so which means the mother has to constantly take care of herself during the pregnancy period. And well, we did mention towards the beginning that during the pandemic they had very little access for diabetes care centers. So how was this dealt during this period?
So during the pandemic, in Sri Lanka, most of the government clinics for mothers, they were open, and so even there was lockdown, the mothers were allowed to come to the clinic, and the midwives would visit them as well. That's in the government system. And we made sure that their blood glucose levels were checked, but sometimes they couldn't get the glucose challenge test done because they would have to wait in a lab for a longer time. So we had to just test them by doing the fasting blood glucose. We might have missed some of the mothers with diabetes because of that. And then the bigger problem was they couldn't get access to insulin. Most of the patients during their pregnancy, we don't treat them with other drugs. We tend to put them on insulin. And some of the mothers found it hard to get access to insulin because insulin has to be stored properly. They have to come to a pharmacy or a hospital to get the insulin, and mothers who couldn't travel found it hard to get access to insulin. So there were some patients who couldn't control their blood glucose levels. We advised the mothers to buy glucometers, and sometimes we gave them glucometers so that they could check their blood glucose levels at home. And then we had to use technology like WhatsApp, Viber, and we would tell them, write it down and send it to us maybe every week, or maybe sometimes every 3 days, so that we could advise them on how to modulate their insulin levels.
So which means they have to control their diet as well at the same time,
yes,
isn't it?
Yes. So when a mother is diagnosed with diabetes, we give them a thorough education on how to control their diet. They have to know about their carbohydrate intake. It has to be at a level, it shouldn't be too much and it shouldn't be too less.
At the same time, you've got to give your nutrients to the baby as well.
Yes, and they have to take adequate proteins, adequate fiber, and fiber comes in the form of vegetables and fruits. Sometimes there are fruits with very high sugar content, so they have to be advised on how much of fruits and how they should take it, and the timings as well. So we usually advise them to take 3 main meals, small meals, and then to take 3 snacks as well in between, so that they can have a good control of their blood glucose levels.
And this shows that you need a very supportive family.
Yes.
Because I think the mother herself, wouldn't be able to handle this all by herself.
Yes.
And at the same time, you mentioned, doctor, that this diabetes condition, gestational diabetes, goes away once they give birth. But does this usually continue for some mothers?
Yes, unfortunately what happens is after the baby is born, the mother neglects herself. She overeats and she gains weight. There is no time for her to exercise, and because of the neglect and the weight gain, 50% of the mothers with gestational diabetes, although it goes away after delivery, they develop the proper diabetes within 5 years. And sadly, most of the mothers, they don't test themselves for diabetes, although we tell them, you know, you are at a very high risk of developing diabetes, and to at least get themselves tested annually, they don't do this. They come maybe like 2-3 years later with very florid diabetes.
And it's very sad because it's just about negligence, isn't it?
Yes.
And doctor, you mentioned that some mothers might continue to have diabetes, and also some mothers who are probably pre-diabetes before pregnancy will continue to have diabetes. So during lactation, do they have to take insulin or medications?
There is just one medication that we give for pregnant mothers, that is metformin. Most mothers ask whether it's safe during pregnancy and lactation, and yes, it is safe. We do give it to a lot of mothers, and we have not come across any anomalies. And then if metformin is not enough, the other thing that we give is insulin. We don't give any other drug, and some mothers do have to take insulin during lactation.
Right. And how about working out during pregnancy, doctor?
So, contrary to the popular belief of not working out during pregnancy, that it's bad for the pregnancy, it is actually good for the pregnancy, and mothers do have to work out. So, we advise them to at least take a walk or do some exercise for 30 minutes every day. And then we have seen that the sugar levels are better controlled if they would do some small activity after meals, like a small walk. Some would do some sitting exercises if they can't walk. We don't tell them to run and jog and, you know, get into
not
contact.
Not the strenuous kind of exercises.
Yes, and not the contact sports. They have to be safe. They shouldn't fall down, but they do have to exercise at whatever rate or pace that they can do.
And also, how about after delivery? And if they still want to maintain, and doctor, you mentioned that most of the mothers, they gain weight after delivery because they have a lot of other things to attend to and they focus less on themselves. So how long should they wait after delivery to start working out?
It depends on the mode of delivery. If they deliver normally, in the normal vaginal delivery, they can actually exercise. It might take a few days or 1 week, and they are back to normal. They can do all the exercises. But if they have a cesarean section, they are usually advised to wait for at least 1 or 2 months till the scar is stronger. They shouldn't do any strenuous exercises until then.
And that could be done under doctor's advice.
Yes, so the doctor who does the delivery would advise them on how long they would have to wait before they can engage in strenuous exercises.
And doctor, you mentioned that usually parents or mothers who have gestational diabetes are prone to getting diabetes if not maintained well within 5 years period. So what should they do to control themselves, or maybe to stay away from diabetes or not have diabetes at all?
Okay, so mothers tend to think, and they are made to think, that they have to eat a lot if they are lactating, if they are breastfeeding a child. They do get hungry a lot as well, but what happens is they overeat. They take far more than they need for themselves and the child. So they have to make sure that they take adequate proteins, they take their calcium supplements, and drink a lot of water, but they should control their carbohydrate and fat intake. They tend to overeat on carbs and fats. That is the problem.
I think it's a belief that, you know, you have to eat a lot so that your baby can be healthy, and you're giving your strength to the baby, and you need to eat more than usual.
Yes.
So I think that's a belief which has been going around.
Yes.
So it's all about having a well balanced diet, isn't it, doctor?
Yes. And if you do have to be careful about, you have to make sure that you take adequate proteins, adequate calcium, and a lot of water as well. So some of the mothers, they stop their calcium supplements while they're breastfeeding. This should not be done. They should take their supplements until they finish breastfeeding. That would improve their bone health as well.
And doctor, you mentioned that having a controlled diabetes or not having diabetes at all during pregnancy can benefit the baby on the long run. Shall we talk about the benefits of being healthy during pregnancy?
Yes. So, if a mother has diabetes, the mother would pass it on genetically to the child. And if a husband also has diabetes, that would make the risk higher for the child. But now it has been shown the environment inside the uterus in which the baby grows in during pregnancy actually really matters for the baby's future and the programming. So, if we control the mother's blood glucose levels very carefully while the baby is inside the mother, the risk of the baby developing diabetes, high blood this hypertension, high blood pressure, the baby becoming obese, all of that, the risk is much less if the blood glucose levels are controlled properly. This is called epigenetics. The baby, it's not just the genes that matter, it's the environment in which the baby grows inside the mother. So, we can do a lot for the child and the child's future and the future generations if we help the mother to control her blood glucose levels.
Exactly, and it's kind of a very hectic task as well, whilst going through all what you have to go through during pregnancy,
yes.
and at the same time maintaining your diet, controlling your blood sugar level. I think this is also kind of like an awareness to everybody out there to be supportive to
yes.
the pregnant mother as well, and not only during pregnancy, even after pregnancy, if
yes.
I'm not mistaken, while lactating, right?
Yes, very much.
And we've come towards the latter part of the program, doctor, so I'm sure you'll have a lot of advice to give to the general public out there, young mothers or maybe mothers who or ladies or women who are aspiring to be mothers. So any advice for them?
Yeah, so I feel the girl child's nutrition is very important. It's not just the boys. Girls' nutrition is also very important. They should be educated and empowered from a young age to eat properly, exercise well. So they should eat adequate amounts of protein, adequate amounts of fiber, and control their carbohydrates, and they should be encouraged to exercise. And this has to come from the family, and the parents also have to set an example. And then later on, once they get married or when they are planning to get married, especially if they are overweight, if there is a family history, if there are any other risk factors, they have to get themselves tested, because diabetes is so prevalent and common in Sri Lanka, and it's missed most of the time. It would really make a change for the baby if the mother is diagnosed before she gets into the pregnancy.
And I think even school education matters
yes.
From a very young age for the people. I mean, not only the girls, I think everybody should be educated on how important it is to look after a pregnant mother, or maybe like what you should do to control yourself or stay away from getting diabetes. I think it's also applicable to men.
Yes. And the other important thing I would like to mention is mothers tend to neglect themselves. The self-care is very poor, and so we would see the mother's nutrition is the worst in the family. She would sometimes make sure that the children eat properly, the husband eats properly, but the mother's nutrition is really not adequate. So it's important that the mothers take care of themselves, eat properly and exercise properly and look after themselves. By that they would be able to look after their families in a better way and set an example for their children as well.
Exactly, and thank you very much, Dr. Samanthi Kure, for giving us an insight as to what gestational diabetes is and the importance of controlling diabetes during pregnancy. Thank you very much for being a part of the show. It was a pleasure having you.
Thank you very much.
With that, we wind up this week's edition of iMed.